Yali Madad. So I've got some good news and some bad news. The bad news is that we're still in a pandemic. COVID-19 cases are still spreading globally, and a new variant of the virus called Omicron has been detected. But the good news is that the vaccines work. They have been proven to protect extremely well against the SARS-CoV-2 virus and other variants, and will hopefully continue to protect against Omicron. We know that the vast majority of people getting infected, spreading infection, and dying from COVID-19 are not vaccinated. Recent Canadian data show that the unvaccinated are 22 times more likely to be hospitalized. So if you've had both doses of a COVID-19 vaccine, why do you need another one? What we're calling a booster dose. Well, remember, vaccines are like practice tests for your body. If it's been a long time since you crammed for that math test, you might need to review your notes to refresh your memory. Booster doses boost your immune memory about the virus for longer lasting protection against it. Studies are showing that vaccine protection against infection may decrease over time, and then the infection can be spread to others. Protection against severe disease seems to hold up better, but there are some studies showing that for some people, like the elderly, that protection against severe disease may also decrease over time. And that's why NACI, Canada's independent expert advisory group, now recommends that adults get a booster dose of an mRNA vaccine, so Pfizer or Moderna, at least 6 months after the initial doses, especially if you're 50 years of age or older, are a frontline healthcare worker, or if you've only received viral vector vaccines. Because studies are showing that protection with AstraZeneca or Johnson & Johnson vaccines isn't as good to start, and that protection decreases more quickly. Now, if you're between 18 and 49, you may also get a booster. And this is especially important for those who are at higher risk because of older age and medical conditions like diabetes, for example. Children and adolescents 5 to 17 years of age should still get their initial doses, but there's no evidence yet that they need a booster dose. People with a compromised immune system, like those being treated for cancer, actually need an extra dose of an mRNA vaccine because their immune response to the vaccine isn't as strong. So if you're immunocompromised, you need a total of 4 doses of the vaccine. In Canada, we're very lucky. Anyone who wants a vaccine can get one. But we can't become complacent if we want this pandemic to end. Some other parts of the world have witnessed big spikes in the new cases of COVID-19 and increases in the number of deaths. In early November, cases in Canada also began to increase. Our increase has been smaller so far because we've got higher vaccination rates, we're wearing masks, and we're generally following public health measures. But what's happening in other countries is a warning of what's to come if we don't continue to follow public health advice. 1 year ago, on December 9th, the first COVID-19 vaccine was authorized for use in Canada. Since then, more than 8 billion doses have been administered worldwide. The mRNA vaccines are safe, and the immune response after a booster dose is even better than after the first doses. So if you haven't had your first 2 doses, or first 3 doses if you're immunocompromised, please get your COVID vaccine. And as soon as you become eligible to receive that booster dose, make an appointment to get it or talk to your healthcare provider for more information. A lot has changed in this pandemic, but what hasn't changed is that to protect ourselves and others, we need to follow our Imam's guidance to get vaccinated. Alhamdulillah, we belong to a community that helps each other. If you have any questions about the vaccines or need support accessing them, please contact the Access line. Thank you for your time. Yali Madad.